suffer with demyelinating neuropathy. What that is nerve damage. And your nerves end in your fingers and your toes. So my feet are like if they're in hot coals, a coal pot with hot coals, 24/7. That will never stop.
Welcome to Dependency TV.
Reality TV at its best.
Where every life is a biography.
I am Garth Sinclair.
And I'm Natasha Nunez. And today on Ion Dependency, we explore the topic of cancer, specifically those that affect men. And we speak with a man who was diagnosed with a rare form of cancer.
We will also speak with an expert from the Ministry of Health about the prevalence of prostate cancer, the urgent need for early screening, as well as the odds of survival if the disease is not caught early.
I've survived a cancer called Poems. It's a very rare cancer. I was diagnosed in 2006, started seeing symptoms in 2003. Poems is really an acronym for plasma, endocrine system, the organs, the monologal band, and skin. Yeah, it's total. So I was diagnosed, good news, I was diagnosed in Trinidad by a very good gentleman, Dr. Keith Young. That was confirmed in the Mayo Clinic in Minnesota, where I go every year since then for care, because while I have a good team of doctors in Trinidad, because of the small population, they're not exposed to this cancer called Poems, and therefore my treatment protocols had to be designed at the Poems. The good news is that my doctors here were able to execute like the chemotherapy, the radiation, and the care. Of course, there's a whole lot of complications that go with that. Ultimately, one of the options for care is bone marrow transplant, but I opted not to do that first and do chemo. It was done in San Grande Hospital by my doctors here, Dr. Capi Capelli and so on, but the protocols were designed by the Mayo and we were able to execute. We have some really good doctors here. So Poems, very debilitating, very challenging, but I was able to survive. It took a long time to diagnose. As I said, my first sign of it was in 2003. Between 2003 and 2005, there were many situations, and I didn't hesitate to investigate all of them. But the one that really brought us to that space is when I was misdiagnosed with diabetes. I almost ended up in a diabetic coma. Because the doctors, as I said, not familiar. Hospitalized quite a few times, but when we put together all the evidence, Dr. Young determined that it was Poems. And although his colleagues, who were part of my team, who did not agree, but because of the respect they had for Dr. Young, they went along. Now they could not only diagnose but treat. But what they had to do for a period of time is to manage, and they did that quite well. I had the good fortune of having family members and doctors abroad who, after the last critical situation, because I did my radiation first at St. James, where I became stable and so on after that. But then in 2006, but then I had another attack Christmas Eve of 2008, which was extremely critical. And that is when the decision was made to source outside help, because what they were able to do is to manage and contain. But after 2009, discovering that it was Poems, what was required then, because of how rare the cancer was, we had to get now foreign help. And at the Mayo, where the experts are with Poems, so I now go to Mayo every year. I have to go every year for checkups, and so far so good. couldn't walk for about 2 years. In fact, I was bedridden for about a year. Couldn't even sit up. The damage remains. As a consequence, I suffer with demyelinating neuropathy. What that is nerve damage. And you know, your nerves end in your fingers and your toes. So my feet are like if they're in hot coals, a coal pot with hot coals, 24/7. That will ever stop. Up to today. They damaged some nerves and muscles in my legs. So if you notice my stand, I have a gait. I can't run anymore. I walk differently now, right? Which has this debilitating effect over time. Meaning, I have to go for regular massages to realign the body. Never so often. Sometimes, you know, don't pay too much attention to those things. But I've come to live with it. I'm alive and well. The shelf life, the doctors tell you, is 5 years. Yeah. But don't always listen. There's some things you don't pay attention to when the doctors talk to you. You live your life, right? So I've been the signs of cancer 2003 in 2019, right? So forget the shelf life. It's about you taking charge of you. Yeah. What I've found, because since then I have encountered many people who have cancer, and I've tried to help. The greatest enemy is your mind. Stress, fear. Don't be. Science have gone such a long way that cancer is no longer a death sentence. Now we have to die by something. We don't know when and how, but cancer itself is no longer a death sentence. Unlike many other lifestyle diseases, we just, as men, we must be in tune with our body. And we must know when something is wrong. Don't be our own doctors. Go have a doctor, have your personal doctor, and go and check your body. You know, it's strange enough, I tell men, we spend so much attention on the car. When we hear something wrong with the car, we go by the mechanic. We like our homes, and when we see something wrong with the window, we bring in somebody. Your body just like that, you treat your body like that. You know, when something is wrong, go and check. And have a doctor, a good doctor. Have one. At least every 6 months, go to a doctor. When you pass 40, more important, see a doctor. Have one. You know, and let's modify our lifestyle. You know, I respect the fact that many of us are not athletic and into the gym and all of that and time. Take a walk. Change your lifestyle. So instead of the elevator, walk the steps. Instead of driving to the corner, walk and come back. You know, there are things that you could do differently in your life. Adapt. You know, adapt. Prostate cancer is a real thing in men. Women have breast cancer and cervical cancer. Men have prostate cancer. But I'll tell you this, there's one common denominator: stress, lifestyle. And it's not that people who feel when they relax and they don't have a stressful life don't get cancer, but it is fueled more by stressful lifestyle and by fear. So, you know, I remember when I was diagnosed, when I was told that I had cancer, I was in Mount Hope Hospital lying down the day for my birthday. And when my wife came with the pathology report and said I have cancer, I started to celebrate. Because for a long time, we didn't know what it was. So now you know what the enemy is. You know how to gather your forces. You know what to target and how to treat it. Being diagnosed with cancer in 2019, I want to repeat, it's not a death sentence.
Your first line of defense is the immune system of your body. Whenever a foreign body comes in like a virus, your own body will make antibodies to try and attack and shut that virus down. That's the first thing that happens. So the stronger your immune system is, the better. Well, that's the whole premise on which vaccines are done. It introduces something into your body that will cause your immune system to generate those antibodies that will recognize a virus if it comes into your body.
We have a lot of very good doctors in Trinidad. The problem is, the challenge we have because of the small size of our country is their exposure to the varying multiple cancers that today have, right? The dynamics have changed significantly in Trinidad and Tobago. And in the region, CARICOM in 2012, and the report going to CARICOM told us that the dynamics of lifestyle diseases in the region has changed tremendously, and so with cancer. Long time, old people just get breast cancer and cervical cancer. Now young women are getting cervical cancer and breast cancer and so on. So we need to be mindful. Men gotta shake the macho, egotistical issues that we carry and have some me time. Have some me time. Take care of you. You have a family, you have your own goals and objectives in life. For you to achieve those, you need to be healthy. You need to be alive. So, see a doctor. Have a team of doctors. Yeah, you need to. You need to have a good general practitioner. And for men over 40, find a urologist that you're comfortable with. See your urologist based on what he considered to be a proper, appropriate timeline, say to see him. Check yourself, Rest is important. And how we eat. But guess what? In all of that, if we don't rest our bodies and our minds, make room for all kind of thing. Don't be too busy running down the money and everything else. We need to put our schedules in our space, especially as we get older, so that we get rest, we eat better, we relax mentally and physically. But in spite of all of that, see a doctor, check yourself, and make sure that you're healthy. Make sure that you're healthy. I tell people, one of the most expensive things I've ever come. If you feel a mortgage is expensive, try paying for medical care. And in Trinidad and Tobago, unfortunately, and not only Trinidad and Tobago, healthcare is expensive. And you asked me about the healthcare services in Trinidad. As I was saying to you, we have a lot of good doctors, but because they're not as exposed to the wide-ranging things on a regular basis, it is difficult for them to diagnose. But I found that once they have their finger on the pulse, they do a good job. We are now changing out the old Jurassic machines we had in terms of radiation treatments. I think that our chemotherapy protocols are quite good. One of the things we need to do better is aftercare in Trinidad and Tobago, across the board, aftercare. But guess what? You can't leave your aftercare to the hospital. You need to do you. And I tell people, my experience, when you're sick and you're down for the count, manage your space. I don't have people come to the door who come and mind me crying and sorry and Darian boy and crying and you can't come to see me. With all due respect, family, friend, whoever, I want a positive space. And you need time to recover mentally and physically. So manage your space. The people vex because you ain't letting them come and take. If you have people coming to your door 24, when you get to rest, when you get to recover. So I learned that lesson. Manage your space, have a positive mindset. This is your body. And therefore, once you go in front of a doctor, you in charge. He is a service, he or she is but a service provider. Ask all your questions and have a contact that when you have any other concerns, you can email and get your questions answered, because it can be debilitating. If you have a concern and it's bothering you, and you have to wait until the next time you see the doctor, and you have to pay to see him to ask a question. We need to change that in Trinidad and Tobago. First, one of the things important to change, they are service providers. Some see themselves as God. We mustn't see them that way. They had about a few weeks ago a program just for men. I think it was an excellent initiative, and I hope that all the regions do the same thing. And I hope that men take the opportunity to go to them. And if you don't get to do that, see about you. Make time. And I'm not talking about the professionals and the executives and so on. The plumber, the mason, the carpenter, the taxi driver, the maxi taxi driver, all men, take care of you. Take care of you. You're taking care of your family, take care of you so that you'll be there for them.
We're now closer than ever before. Yet it took social distancing to get us there. We're now more aware of how interconnected we all are. Yet it took a virus to teach us what was always obvious. We're more health conscious of ourselves and the environment than ever. Yet it took a global pandemic to create such consciousness. We're wiser now about the planet we share together, yet we just can't afford another lesson on how we need to live this life better. One way, one world. Live easy with Guardian Group.
If we look over the past 2 or 3 decades, we realize that men and women in Trinidad have been living longer. So now in 2018, if you're a man in Trinidad, you probably, in 2018 you would have expected to live to about 70 years. Women doing much better, 76 years. And if you took that about a decade or 2 before, you're living 60 years would have been a big thing. So now people are living, they're getting older. And what we know is that as we get older, we of course new diseases and diseases become a lot more prevalent. And one of those diseases is actually cancer. So right now in Trinidad, we know that cardiovascular disease and stroke are the leading cause of death in Trinidad. And cancer is just behind diabetes and cardiovascular disease. We expect probably in the next 5 to 10 years that cancer will overtake diabetes and heart disease as the leading cause of death, as we begin to be able to treat diabetes and all the other risk factors associated with heart disease. So as a whole, the incidence of cancer is actually increasing. And when we look at males, so both males and females get cancer. And it's actually quite interesting, except for the gynecological cancers. Men could get any cancer that women get. Sometimes we forget that men could get breast cancer too. So that's very important to always remember. But prostate cancer, as you said, is actually the most common cancer amongst men. So prostate cancer is the most common, and it probably accounts for about 1 in 5 of all cancers and about 1/3 of all deaths related to cancers in males. The other common cancers that we see in males would be lung cancer, colorectal cancer, you get pancreatic cancer. So those are about the leading causes, and we have all the other cancers that you could get. So prostate cancer in itself is really a big problem that we have. And in the Caribbean, and Trinidad being part of it, we know that prostate cancer is actually a bit more aggressive than we would probably see in the other populations. So for example, if you were to look at the, a lot of the data has come out of North America, so they always look at what they call the Afro-Caribbean population. And we know that the prostate cancer is a lot more aggressive in our population than we would see in some of the others. But we want to pick something up before it becomes symptomatic. And that's the most important thing. So symptomatic means that you start having symptoms. So you go to the doctor because you have problems with your urine, or you're having, say, something like back pain, different things like that, problems with erectile dysfunction. So you go in when you're perfectly fine, when you're normal. So you go in for your regular visit. So that's what screening means. And screening for prostate cancer really involves two things. It involves a blood test called a PSA and a rectal exam using the finger. So it's called a digital rectal exam. And we usually recommend, so there are no definite guidelines in Trinidad, and the guidelines vary from place to place. But we usually say by the age of 50, most men should be having their annual PSA and rectal exam. And what is important is that we want to, if it is that we can pick a cancer, we want to pick it up before it has gone very far, before it actually has caused symptoms. Because the earlier we can pick something up, the earlier we can treat it and the better the outcome. There's a lot of controversy. There's a lot of controversy over PSA screening. Because people always look at the benefit of PSA screening, because we say that a lot of times maybe we probably are picking up so many cancers now that we probably may be over treating some people, because some people may die from something else and may not die from the cancer. So there's a lot of controversy, but very generally, we usually would say by the age of 50. Now, if you have a family history, that means you're in a higher risk group, you should probably start screening a little bit earlier than 50. But really what we're doing is we're using a simple test, which is a blood test. So when you go to your doctor after the age of 50, you should really be going also to check your weight and get your cholesterol, your diabetes check. And when your doctor examines you, one of the things the doctor will do is a rectal exam. If the doctor finds that there's something abnormal on the prostate, as a conversation we would have had before, then you would want to then go and investigate to see if there's something that is abnormal in the prostate. So survival depends on what we call stage of prostate. If it's a prostate cancer, it depends on the stage. And literally, the more advanced your stage is, it means the chance for survival, the chance for cure becomes less, right? So the earlier you pick something up, you could have a curative potential, close to 90%. And then as the stage becomes more advanced, it means that the chance that we would be able to get the cancer under control and in remission may become less than that. One thing is important, sometimes people look at the percentages and they go like, oh gosh, because people go and they Google, right? Everybody goes on Google and then they see something called the 5-year survival. So they think, okay, I'm only going to live till 5 years. That doesn't mean, all it means is that it just looks at how many people with the cancer are alive at 5 years.
Okay.
So it means that even if you did get something a little bit later, it still means that you could have a good chance, you could still have a chance for survival. What the test involves, it involves the doctor actually using his finger, or her finger, and actually feeling the prostate. Now, it's maybe a little uncomfortable, but it's usually done once a year, and by most stretch of an imagination, most people will probably not have a significant issue with it. Now I know that sometimes what people hear about is they hear about what happens after that examination if there's something wrong. So
Right.
people hear about where they have to put like the ultrasound probe inside the rectum in order to be able to check the prostate and so. So that's usually a follow-on test if we've picked up that there's something abnormal.
Okay.
Right? So it means, therefore, that very simply, with your blood test, and you could always think about it, you could do your PSA blood test at the same time if it's just your regular screening when you're checking for your blood sugar and your cholesterol. So it could just be one set of blood that you're taking at the same time. And while the doctor is examining, it takes no more than less than a minute in order to be able to check and see that everything is okay. So, but when you think about it, right, and you think that, and you know, one other thing you also know is that when the doctor actually checks, he's not only checking the prostate, but he's doing a rectal exam, so he's also able to check your rectum.
Right.
And we know that colorectal cancers are rather common,
Right.
and about a third of colorectal cancers actually happen in the rectum, so they can actually feel it. Okay. So it actually means we get a rectal exam done, checking the rectum and the prostate at the same time.
Right.
So I would tell my patients, I would say, you know what? Instead of buying your dad or your grandfather or your uncle cologne or a tie or a shirt or something like that they will just put away in the cupboard, get them a PSA exam and get them a rectal. Is something that will really be very, very important and will give them a good, this is giving them a gift that they will appreciate. And this holds for the other regional health authorities. You can go to your local health center, right? And when you see the doctors, they'll do your routine exam, your rectal examination, your PSA along with others. So that could be done at the health center. We also have our mobile clinics, so where we actually go out to the community or to the marketplace. So you get your PSA done. We're not able to do the rectal exam at that point, but we could check your PSAs. And of course, you can always access care of your family doctor. Some people have their family doctor who, they go to privately, and some people may go to a specialist in order to have their tests done. But by and large, the majority of people, when they go for screening, they go to their family doctor, to their health center in order to be able to have their annual checkup.
Agricola Credit Union Cooperative Society Limited introduces its new and improved mortgage loan package from as low as 5% per annum. Home renovation, purchasing a home, constructing a home. Come to your credit union today. Speak to our friendly and courteous staff. See your dreams come true. All lending criteria apply. Check us at our head office, 20 Phillips Street, Port of Spain. Arima branch office, Pro Queen Street, Arima. Tobago office, Plymouth Road, Scarborough, Tobago. And our Marabella office, Pamela's Mall, Marabella. Agricola Credit Union, your very own, working for you. Some of us like to play games of chance, but remember, gaming should be fun, so don't get carried away. Play for a prize, but don't pay the price. Play for fun, but never for keeps. Play smart, but never play all. Winning isn't everything. If you or someone you know needs help, call our gambling addiction hotlines. Rebirth House 24-hour hotline 466-3146 or Serenity Place Empowerment Center for Women 648-5401. An initiative of NLCB and Eye on Dependency.
I'm Dr. Narinesingh. I'm the Director of Health at the Northwest Regional Health Authority, as well as I'm an oncologist. And I would like to really emphasize the importance of taking care of your health as a male. It is important that for screening for prostate cancer and screening for colon and rectal cancers. In terms of screening for prostate cancer, the earlier we're able to detect your cancer, the earlier the stages and the better the outcome. My advice is talk to your doctor. You can access care at your health center or with your private doctor or at our mobile health mobile clinics, and it will involve screening will involve a PSA as well as a rectal exam.
A cancer diagnosis is not a death sentence. Prevention is important, early detection is helpful, and treatment, along with support from family and friends, is essential for recovery.
So join us next time for another informative edition of Dependency TV. The topic, sexual and reproductive health. See you then.
Dependency, reality radio at its best, every Sunday from 6:15 to 8 p.m. on I-95.5 FM. Don't miss it.